Participant list. All right, we are officially started, I suppose, once we start the record, hit the record button. It is just a minute after 8, but we have so much to talk about today. I don't want us to delay any longer. So once again, good morning and welcome to Eggheads, the Colorado Health Institute's monthly webinar series. Thank you for joining us on this beautiful Thursday morning here in Denver. I am Sarah Smith, and as of last week, I am CHI's new president and CEO. It is my first chance to address our friends and partners in this new role, and I just wanted to take a moment to thank all of you for your continued support of CHI, what over the last year has really been a period of transition for us. So we're very grateful to all of you. Thank you for your partnership. I am also very grateful to the entire CHI team who, again, over the last year, has continued to advance our mission of improving health of all Coloradans through independent research and analysis and insights that advance sound policies and decisions. That's who we are. So if we could just keep clicking through our screen for today, our slides. Here's what we're going to be chatting about. We're going to talk about that in just a minute. If we could go to the next slide. This is who we are. This is who we are at CHI, and this is what we do every day. As we look to the future, we at CHI will be continuing to advance health equity and well-being for all of our communities. We will continue to be your trusted source for data and evidence, for thought partnership and sense-making, and our team, alongside and with partners like all of you on this call today, will play an even bigger role in creating the systems that allow all people to thrive. And as we are getting started with our webinar today, I wanted to also get us warmed up in the chat if we could. What is one thing that you would like to see happen for all Coloradans to thrive? If you could open up the chat, make sure that you are chatting to everyone. Please put an idea in there. What's the change that you want to see? Be bold, give us some ideas. Let's just share a little bit about what is on your mind in terms of change for the rest of this year, for the future. I'll give people a minute to throw that in there. Outdoor air quality. I know there are many people who are focused on that. Including our Acclimate team, who we are so excited to be partnering with across the state. Access to mental health resources, here. In case you've just joined, we're putting into the chat ideas for change. What we need, what you would like to see happen for Coloradans to thrive in the future. So please continue to drop that into the chat. I know that we have a lot to be talking about. Make sure that you're chatting to everyone so that we can see it. Affordable housing, thanks, Courtney. If we can, let's click to the next slide, but please don't stop. Keep sharing some ideas because we want to see what's on everyone's mind. Today, we are going to focus today on hunger. That is the focus for our webinar. And I'm pleased that we are highlighting this issue because we do know at CHI, all of you know this as well too, that health is so much more than access to care and what is happening in a doctor's office. We can't be healthy, we can't be well when we are hungry. Simple as that. Recognizing this, about 4 years ago, CHI added questions to the Colorado Health Access Survey, known as the TAS, to get a sense of hunger in the state and its relationship to Coloradans' health and well-being. This is one of the unique aspects of the TAS, that it allows us to look at the relationship between these different issues as it relates to health, well-being, and access to care. This morning, we are going to be highlighting some good work of our partners who are working to address hunger, and we'll share a dashboard that CHI built for the Colorado Blueprint to End Hunger. That dashboard includes TAS data, as well as other sources of data that help us get a full portrait of hunger in Colorado, which is an important first step if we are going to be taking action and working for that change. So joining us today will be my colleague, Rachel Boyer, who has led CHI's work developing the dashboard. She will be joined by Justice Onworthy with the Colorado Blueprint to End Hunger and Megan Moore with the Pueblo Food Project. So with that, I'm going to toss it over to Rachel, who will take us off, give us an overview of the dashboard. Then we'll hear from Justice and Megan. Thanks, everybody. Good morning again.
Hey, everyone. Welcome. My name is Rachel Boyer, and I'm a research analyst with the Colorado Health Institute. And I specialize in our quantitative data analysis and visualization. And I'm really excited to be here today to share in this conversation about hunger in our state and the various efforts that are going on to combat it. But before I start, I want to remind everyone that this session is being recorded. We've also activated captioning for speaker remarks, which you can activate at the bottom of your screen. And we'll also save time for questions at the end of the presentation. That being said, if you have questions, we love questions. So please drop them in the chat or the Q&A, whatever makes the most sense for you. And my colleague Joe will respond as we're able to. So we're going to have a three-part presentation today. I'm going to talk about this new dashboard, why it's important, how you can use it. And then Justice is going to give us a statewide view on hunger policy and what's happening at a high level. And then we'll end with Megan from the Pueblo Food Project, who will talk about the work that's happening in Pueblo on the ground. So I'm really excited to kick us off, and I'd like to tell you a little bit about this dashboard that we made. So the goal of this dashboard is really to increase transparency and access to hunger data in our state. There are several key players in our state that publish kind of statewide large-scale data about hunger and food insecurity. And we wanted to bring all those pieces of information together in one place. So they're all together and they're kind of easy to interpret as a whole and easy to find. So to that effect, the dashboard is meant to capture key trends in hunger in our state. And this includes not only statistics about food insecurity, but also about poverty, about food access, and also some voter public opinion polls on the issue of hunger. All of the data from this dashboard is aggregated from publicly available sources. And it has breakdowns by county, in some case school district, and various demographic characteristics. Language justice is also really important to us. So this dashboard is available not only in English, but also in Spanish. And we'll be sharing the link with you later on at the end of this presentation. So I think when we're introducing a tool into the community, it's really important to talk about how to use this tool and what are the strengths and limitations of this tool. So let me talk first about the strengths. The strengths of the dashboard are that it really allows you to view key trends in the state and to compare different regions and counties within the state. There's lots of interactive maps that you can check out and lots of information that allows you to look at specific regions that might be of interest to you. Another strength of the dashboard is that it really allows you to visualize the data that's available. So there's a lot of data out there and it's hard sometimes to understand what exactly the trends are, what is the story that it's telling us. So the dashboard really brings that all together and makes it very user-friendly. Some limitations of the dashboard is it doesn't include a lot of qualitative information. That's kind of our non-numbers information, such as community voices, stories, focus group results, etc. Not to say that that information isn't very important, but this dashboard focuses mainly on numbers and statistics. And that's why I'm really pleased to present this dashboard along with the blueprint and the Pueblo Food Project to show you kind of overall what are some data available in our state, and then what are some broader efforts in the state, and then focus more locally on like what is an example of what a specific county is doing. What this dashboard can really help you do is orient yourself to the data that's out there. It can help you ask more pointed and specific questions and really help you understand the data landscape and where there might be opportunities for advocating for more data collection, especially for vulnerable groups. So without further ado, I'd like to actually jump right into showing you our data dashboard. Okay, so this is our data dashboard homepage. It lives on the website for the Colorado Blueprint to End Hunger. And you can view it in this view, but the best way to view it is actually to go down to the right-hand side of the screen and click on the full screen button. That'll give you a full screen view. So there's a lot of information contained in this dashboard, so much information that we don't really have time to go over all of it because we want to leave time for other speakers. The main categories of information that we have are poverty, food insecurity, food access, SNAP and WIC participation, child nutrition, and the public will for ending hunger. This dashboard is really built for the user and for you to explore on your own curiosity. You can click on any of these tabs at the top in any order and really drill down on an issue that you're interested in and a region you're interested in. To kind of show you the data that's available and the capabilities of this dashboard, I'm gonna kind of answer an example question to kind of demonstrate what we have here, but we really encourage you to explore this after this presentation on your own and really share it widely with your networks. It's really meant to be a tool for the community and really meant to spark a lot of conversation about this issue. Okay, so my example question that I'm going to answer is, what does food insecurity look like in Arapahoe County? What are the programs going on there? What are people's opinions about hunger in this area? So let's see what kind of information is available for that. So the first thing I can do is I can go to our food insecurity tab and I can check out what information is there. So this is going to give me some key statistics from various sources about food insecurity. If I scroll down, I can see that there's a map of various counties in the state and what food insecurity looks like in there. So if I go to Arapahoe County, I can see that about 8.6% of people in this region reported they didn't eat as much as they thought they should sometime in the past year because they could not afford food. And each statistic is associated with a source. In this case, this is our the source is our Colorado Health Access Survey. So with that information, I can also think about, okay, what does participation look like in SNAP and WIC in this area? And so of course, I'll go over to that tab and it'll give me some information about these two programs. If I scroll down, I can check out the WIC coverage of Medicaid map. And this is basically a measure of cross-pollination between these two programs and cross-enrollment. So if I look at Arapahoe County, I can see that overall, about 37% of children who are in Medicaid are also in the WIC program. And so in an ideal world, this percent would be 100% because these programs are cross-eligible for this population. So I could see that perhaps there's some work to be done in enrollment in this space. I can also see how hunger is affecting children. I can go to our child nutrition tab, and this is going to have a lot of information about state school nutrition programs. If I go down to this map, oops, sorry, I could actually see some information by school district. So if I click on a school district that is in the area of interest, then I can see some really cool key information about this school district as it relates to school nutrition, child nutrition. So for example, this tab is telling me the percent of students who qualify for free and reduced lunch. It's also showing me some participation in various state nutrition programs by type of meal, and also some key information about student demographics, such as the size of the student population and also some race ethnicity breakdowns. And the final thing I'll show you about this dashboard is that you can also check out some information about recent hunger policy. This page is going to be updated as kind of hunger policy initiatives are bubbling up to the surface in our state. So up at the top, you can see some key information about some voter polls that have been conducted with regards to support of the SNAP program, support of anti-hunger programs. And then you can also check out this map, which shows you the voting results from Proposition FF, which was Healthy School Meals for All. This was passed in the last election, and it provides an avenue for every student, regardless of income, to get free school meals. If I look at Arapahoe County, I can see that the majority of people in this county, 58%, supported this measure. So that may indicate to me that there is certainly interest in supporting anti-hunger initiatives in this area. So that's just a quick walkthrough of what this dashboard can do. Again, I really encourage you to all to share it out into your networks. And also, I'm happy to answer questions about this dashboard and how it relates to kind of broader hunger efforts going on in our state in our discussion section. So with that, I'll go ahead and hand it over to Justice for her presentation.
Thank you, Rachel. I appreciate it. I've appreciated your support with the dashboard and your partnership as well. It's such a great tool, and we are so grateful to you. I am Justice Onwardy. My pronouns are she, her, hers, and I am the impact manager with the Colorado Blueprint to End Hunger. We are a statewide collective impact organization working to address hunger across the state. So I'm going to start with some of our goals and visions within the blueprint. We have 5 goals. We also call them our guiding stars. We aim to increase public understanding and awareness about solving hunger issues. This is through building community leaders that can learn to advocate for themselves. We try to increase the number of Coloradans who have access to local and nutritious foods, and increase the number of Coloradans who have easy access through local organizations such as grassroots organizations, food pantries, food hubs, and things like that. And then we're aiming to maximize enrollment in SNAP and WIC, which is our supplemental nutrition assistance program, and our women, infant, and child nutrition program as well. And then we're aiming to maximize federal child nutrition program enrollment. This isn't just through school lunches and things like that. We're trying to make sure that students and youth have access to food year round, 7 days a week. This shows our framework. So like I said, our guiding stars is what makes up our work groups 1 through 5. We've combined our work groups 2 and 3, which is focused on accessing healthy food within communities. But all of our work groups have our project teams, which you can see on the right-hand side. There's about 2 to 4 project teams per work group. And our project teams are more of the action-oriented side, where they're trying to work on the policy work, micro grants, community organizing, and things like that. And then our work groups meet about once a month to talk about what the project teams are doing, to help with strategizing, and make sure that everyone's connecting on the goals of the work group. And our work group is made up by our community members, our partners that we have across the state, which are a variety of organizations, one you'll be meeting later today, and as well as our state partners, such as state agencies like the Department of Ag, the Department of Education, and things like that. And then we have some special projects, such as our Farm Equity Coalition and our Funders Collaborative. So next, I'm going to go through, briefly go through some of our community wins and successes around maximizing federal child nutrition programs. We've created a child nutrition asset map, which shows where summer feeding sites are. So when students aren't in school during the summer, there might be a library, a Boys and Girls Club, YMCA, or something like that, that is providing breakfast and lunch and snacks throughout the day. So we've created an asset map that shows where those sites are, and we try to update it annually. So schools, families, and other organizations can provide that to their community as a tool. We've produced and promoted marketing around healthy school meals for all, and supported marketing to make sure that school meals are at a quality level and supporting local produce. And then we partnered with the Department of Ed this year to create a Medicaid direct certification, which we were just approved by the USDA for a pilot program. So families that are enrolled in Medicaid now can also apply for free or reduced lunch. Like I said, we expanded access to summer meals, we created a story map, and we've supported the implementation of healthy school meals for all. We've also designated over $300,000 of funding to support local and community and government organizations to increase their cross-program alignment with Medicaid, SNAP, and WIC. So such examples was creating a texting toolkit For families enrolling in SNAP, it's a 3-step process where they fill out a form, they have to go back for an interview, and then they have to go back to pick up their EBT cards. And so we've had partnered with another organization to have a texting feature that sends reminders and updates on the process for families to know where they're at and when they need to show up for their next appointment. This year, we also led the largest anti-hunger state policy platform with 8 legislative priorities for the 2023 session. The majority of the supported bills were signed into law. One of the most exciting ones I just chose to feature was House Bill 231087, which is a fiscal rule advance payment for charitable food grants. So this means that our partners can who have funding from the government are able to forward purchase their food, and they can order ahead of season instead of having to spend down their money in an expedited amount of time. And I'm happy to answer any further questions about this later. We also launched an anti-hunger advocacy academy, which was helping build up community leaders to be able to lobby for food justice and food policy across the state within their counties and different areas. We had a mentorship program where we had about 6 mentors, but we had over 100 participants that were interested in being advocates. And we plan on continuing this next year. We also have been supporting the Food Pantry Assistance Grant Program. Some of you might be familiar with that. This year, we dispersed about $4 million to 245 food pantries, which was really exciting when last year we were only able to support 142 pantries. We had over 300 pantries apply, and they requested about $10 million in total. So as you can see, that there's a huge barrier on how much funding is accessible versus what the need is across the state for hunger. And if you have any questions or you're interested in learning more, you can email me or visit our website endhungercolorado.org. Next, I'd like to pass it to Megan Moore, who is a recipient of our FPEG grant that I had just discussed and has been an awesome partner.
Good morning, everyone. I'm just pulling up my slides. Thank you so much for that introduction, Justice, and thank you for all the work you're doing across the state. So good morning. My name is Megan Moore. I'm a program manager for the Pueblo Food Project. Our service area is Pueblo County, and we've been doing food work for about 3.5 years. So Pueblo Food Project is a community-led coalition focused on creating a more vibrant, nutritious, and equitable food system for every eater in Pueblo County. We got our start in September 2019 as a way to connect farms to the city. We have about a 2-mile distance from our over 800 farms on the county and 2 miles from city center. So economic growth was the focus, but through the pandemic, PFP really grew into what it is now. So our coalition is made up of 150 members. We have about 9 functioning programs. Coalition members and organizations will participate on one of 5 working groups, and then we have a task force. Below you can see our stakeholders. We really try to focus on being a backbone organization in the food system for all Pueblo organizations. So this is a short list of our programs. I'll go through each of them a little bit more in depth, but you can get a little bit of a summary right here. So we have a food pantry. We work with our community gardens. We've developed a hydroponic growing curriculum. We have a youth-led chicken coop program, a youth council, a conference called Sun, Soil, Water Ag Summit, an entrepreneur development program for food businesses, our hunger relief task force, community meal prep cooking classes, and as always, our coalition focuses on engagement and justice, equity, diversity, and inclusion work. So our Hunger Relief Task Force, Community Meal Prep Cooking Classes, and Community Garden Sustainability Project and Edible Landscapes all focus on food access. So Hunger Relief Task Force is a way that all of our pantries and food organizations can talk to each other once a month and share resources and learn what's going on across the city. Our Community Meal Prep classes are focused on hunger relief for families. So as you can see below, we've got quite a few in there, but we have the focus is hunger relief. So families come and cook a meal that they'll take home and warm up later. We make a meal, the volunteers for everyone to eat that day, and often everyone's able to take the ingredients home to make it a third time. So there's 3 options of hunger relief. And we've been very proud of that program. This month we hit 1 year of processing. We're very excited about it. Community gardens and edible landscapes have been flourishing for the last 3 years. We have our 4th season of edible landscapes and 2nd season of the Community Garden Sustainability Program. There's about 10 gardens total that Pueblo Food Project is focused on in the community. And every single one of these gardens goes directly back into the community. Or the food does, sorry, not just the gardens. And our community-led programs are the Sun, Soil, Water Ag Summit and the Pueblo Food Project Coalition. Our coalition is made up of community members and organizations focused on supporting the food system in many different ways, which from the coalition have come all of our programs and events and things like that. So coalition made Sun, Soil, Water Ag Summit along with all of these other things. So the Sun, Soil, Water Ag Summit is once a year, and we focus on bringing education to the community. And that can be focused on agriculture, focused on growing your own food, or specifically in food systems. Last year was a success, and we're very excited to continue this. And this one's very exciting. So we have an entrepreneur development program focused on supporting the local food economy. This last year, we were able to graduate our 2nd class of students. So we've graduated successfully 20 students from this program who have all been growing successfully in their businesses. But this picture is one of our students from this year. Her name is Christiana. She's 10 years old. She wants to open a boba business and did so fantastic in the class, won a little bit of money from the pitch competition. And this is just a little picture of her doing the work. So it's really exciting to be able to work with all kinds of people throughout the community food system. And then we also have our youth program. So our Fujikits Youth Council, their name is Fujikits because they came up with food and educate and smashed it together. They've done a lot of fun projects. They're able to lead their own work, so they come up with their own ideas and make things happen. But this last event that we had, we watched the movie Ratatouille and made Ratatouille. And it was very exciting and everyone really loved it. So they get to do fun things and really focus on what would be important for students to learn and also what would be fun. We have our youth-led chicken coop project. So we haven't quite started yet. Hopefully this fall we'll be running some chickens, but this is what our chicken coop's going to look like. We'll have 4-H and our Fujikits manage the majority of the functioning through the youth-led chicken coop program, but almost all of the eggs will go directly into the charitable food system in Pueblo County. A lot of our funding from the Colorado Blueprint to End Hunger has gone directly into the Pueblo Food Project Community Pantry. In the past 3 years now, we've spent $900,000 in local food procurement. Over 30 pantries are served from the food that we're providing to the community. So our community food pantry works a little bit more like a food bank. So we buy only local food and store it for the community to use in their pantries. And it's been an incredible project. All of the money that we've gotten has gone straight back into the local community. And this is just some of the people or some of the businesses that we've been able to support. One of our biggest products is meat and green chili, of course, Pueblo green chili. But it's hard to come by high quality meat in the charitable food system. So sausage, beef, and chorizo have been very important products for our community. But the Colorado Blueprint to End Hunger has supported so much of this funding through the Food Pantry Assistance Program, and it's been incredible. So we're excited to keep this program rolling, but it's been such a blessing to be able to see these suppliers and local businesses grow through our programming. And lastly, Pueblo Food Project is in the process of transition. So right now we sit under the City of Pueblo government as a project of the government in the mayor's office. We're looking to become either our own 501c3 or find new fiscal sponsorship or something along those lines so that we can be our own separate entity. So we're working on that right now and working on a long-term sustainability plan for financial resources. So the way we function now, hopefully will continue through all of this future planning, but it's been a very exciting and very rewarding few years that I've worked with Pueblo Food Project, and we're very thankful for organizations like the Blueprint who support our work to no end, and it's been such an incredible journey. And I think that's all for me. I think that I hand it back to Rachel.
Yes. Oh my gosh. Thank you so much, Megan, and Justice. It's so it gives me a lot of joy and hope to hear about like the various efforts that the Blueprint are taking at our state level, and then also to hear about like the specific projects that are going on in Pueblo. I mean, there's nothing more wholesome than boba and chickens. So with that, I think we're ready to switch over to our audience Q&A section. So please put questions in our chat or in our Q&A. We'd love to hear from you. And I think we had some questions roll in as people were speaking. So do we have a first question lined up?
Hi, this is Joe Hannell from CHI, just a voice from the ether here. We have a question from Zach Ducharme. Can we unmute him now?
Yeah, good morning, everybody. Can everybody hear me?
Yep.
Great. Yeah, I just had a question for Megan. I'm just wondering, you did elaborate on the Fuji-Kids program, but I'm just curious if you can tell me a little bit more about like the structure and the logistics, how that group formed, how frequently they meet, how it's funded, recruitment, all that.
Yeah, so the Fuji-Kids was developed before I started, so I don't really have a lot of information on how they came to be, but it's mostly high school students. We have an intern. We have 2 interns actually that are college age, and we have 1 8th grader because they were particularly excited to join. So over the summer and towards the beginning of the school year, we send out applications through just like a Google form, and students fill those out. We go through them, and in the last 2 years, I think we've accepted almost everybody to join. And they meet once a month, and depending on what activities there are, we might meet 2, but one will be like an activity event and one will be an actual meeting for planning and such. So the students are involved in that way, but we also like to take them on like field trips. So 1 month might be they have a planning meeting and then we go out to a farm or something. We're hoping in July that we'll end up at Pueblo's regenerative farm. We only have 1, and they'll learn about regenerative farming and maybe pick some harvest. But yeah, they meet about once a month. They're so much fun, and it's fun to get to see them be creative, because when we're in our planning meetings, I basically just ask them, what do you want to do? And they have such great ideas. I mean, the ratatouille night was genius and so much fun.
Cool, thank you.
Awesome. Thanks, Zach. We have another question in the chat from Mika, which is, can you say more about the survey and the responses? And I think this is kind of referring back to the dashboard section. So as far as the Colorado Health Access Survey, that is a survey that CHI does, and it's a survey done every 2 years of a random sample of 10,000 households in Colorado. So that one is quite a large and extensive household survey in Colorado. Mika, let me know if there was another source that you're interested in as well. I will say that if you are exploring the dashboard and you find yourself really interested in the data source or the data methodology, we would love to answer your question. So just feel free to email me or Justice. We know that accessing data is sometimes a pain point, so we'd love to help you with that process. So as you're exploring the dashboard, let us know if you have any data questions. Okay, so we have another question from David in our question and answer box. So David is asking, I think this is for Justice. Did you say that 3 appointments are required to get going as a SNAP beneficiary in Colorado?
Yes, I did. And in some instances, if you go to like a community garden or a food pantry, they might have what's called like SNAP Ps, which are their state funded basically positions that are able to have community members and people trained to help with the application process, so they can support you with the application there on site. So people might be completing an application outside of a state department, or they can go in and complete an application themselves. But if you complete a paper application, you have to go in and turn it in. And then after that, you have to complete an interview. They now have it where you can do an interview over the phone. It doesn't have to be in person, so you don't particularly have to go in again. And then you have to pick up your EBT card once you get approved. They've now kind of changed the way that's gone, and you can apply through Colorado Peak. So you can apply online for a card, but you still have to do the interview process. So there's still a second step. So that can still be over the phone. So you don't have to go in. And then in some cases, they can send you your EBT card, but a barrier that has popped up, not new, but something that the blueprint is addressing, is how do we get people who are unhoused, college students who don't have a concrete address or things like that to be able to access these benefits, because you also have to have a permanent address to be able to enroll in SNAP. So I hope that answered your question.
Great, thanks, Justice. We have another question from Megan, not our panelist Megan, but a different Megan. Megan, are you able to come off of mute to ask your question live?
Hi, good morning.
Morning.
So I was, curious hearing from you all, being in the roles you are, what impact you're seeing on the food support system with the recent reductions in the PHE expanded SNAP benefits. That's having a large impact on people, but I'd love to hear your perspective.
Yeah, Justice, would you like to take a first crack at that question?
Sure. Yeah, I was gonna pass it to Megan. I got this. Yeah, I think that's a great question. We've kind of seen a lot of issues that have come up with, as well as like community members who are losing their SNAP benefits and like what that looks like. We've also had a decrease across the state in some other areas of funding for local food support systems as well. So that's why this year they increased the FPEG supplemental from, as you could have seen in my slides, last year was about 2.3 million to the 4 million this year, to increase the amount of emergency funding going out to kind of make up for this loss in SNAP. And then about 9.5 million went to food banks. So I think it was Food Bank of the Rockies got that, and another food bank that's in Southeast Colorado. to kind of try to mitigate these issues that have been coming up so we can better support our producers across the state, but make sure that everyone has access to food. And like I brought up with that House bill that the Blueprint helped pass, we now have forward purchasing, because with government spending, with government funds, you have to spend it down in an allotted amount of time. But now our grantees and food pantries are able to use the spending to order ahead of time, so they can reach out to producers and say, hey, we're going to need more grain, we're going to need more pork, we're going to need more corn for the spring season, so they can plan ahead on what to order, so they can be able to spend down faster, but have food dispersed and spread out throughout the year. And Megan can talk about what that looks like more locally.
So from our point of view, we've seen a significant increase for pantry usage across the city. Almost every pantry has reported up to a 60% increase in clientele coming in at every opening. And it's caused a lot of stress for the pantries to manage that many people. They've had to put limits on how much people can get, more than usual, so that everybody's able to get hopefully a similar amount of food, but they're also able to serve everyone who's coming in. And it's been difficult for our community to get the resources that they need to fill with the food that they need. So we really want to focus on, supporting healthier choices, but that can be really hard when all of the options out there for donations and such aren't as healthy as possible. So it's been complicated, and the conversation of resource sharing, especially in grant applications, has started to come up amongst pantries. Like, how do they support each other to be able to get the most amount of money for more than one pantry instead of just one for a single one. But it's been very hard for our community, and we've seen an increase of people just reaching out to even Pueblo Food Project and saying, like, where do I get food? And all of these various things. So it's made a huge impact on the local level, and hopefully over the next year or so we'll be able to relieve some of that.
Yeah, thanks for the question, Megan, and thanks for answering Justice and Megan. I think it's a really important thing for policymakers to keep in mind is, when we have these hard transition points, or when we have a lot of administrative restrictions on grants, it can really get in the way of serving people who are in need and really confuse the existing food systems. We have another question from David. And his question is, why are there such low percentages in people enrolled in WIC, perhaps between the cross enrollment between Medicaid and WIC? That's a tough question. I don't know, Megan or Justice, do you have kind of insight into WIC enrollment in the community?
Yeah, I do and I don't. I know that a lot of those who are enrolled, who are WIC eligible but not enrolled, might potentially be enrolled in SNAP. And also for the 2023 year, I just had a meeting with CDPHE actually 2 days ago, that this year is the highest enrollment in WIC that they've seen since 2018. And so I think that it's a matter of like funding, because WIC is not like federal funded in our state. It's not the same as SNAP. It's on like a state level, and it also looks different how we measure it, track it, and how to apply for that process, and how they market WIC as well. So they've done a lot more promoting WIC through either it's like prenatal or doctor visits, of trying to help women get enrolled in WIC during their appointments, and kind of trying to make that process easier, kind of like a one-stop shop, versus them having to kind of go through the similar process of like going in, submitting an application, going through interviews and things like that. But essentially just being, you're on Medicaid and a doctor says you should be on WIC because you also meet these nutritional standards based on where you're at. So yeah, but it's increasing this year, and I think it has a lot to do with CDPHE doing a lot more promoting of it and making that process easier for clients of WIC.
Thanks, Justice. Let's see, we got some more questions here. So Michael, are you able to come off of mute and ask your question out loud? Okay. So Michael, go ahead and unmute yourself, and you're going to be able to ask your question. Okay, I'm going to go ahead and ask Michael's question. Are there any interesting or innovative policy initiatives across the country that you think could move the needle on hunger here in Colorado, or at least worth considering?
I can take that one. There are quite a few. One that I put in the slide and that we just got approved for was the Medicaid cert for schools. So when students enroll in or their parents complete a form so they could have free or reduced lunch, they look at income and some other qualifications, but they weren't looking at Medicaid. And that wasn't a way to be able to qualify for free or reduced lunch in the past. And there's a few other states, I think 4 other states that were on this pilot through the USDA. And we just applied for it and we were just accepted. And so it's a 5-year pilot that we're now starting in Colorado for the 2023-2024 school year. And essentially, what that means is that more students are going to be eligible for free or reduced lunch. And even though Healthy School Meals for All has passed, which is a really exciting thing, and Colorado is the first state to be initiating that, we still need to be able to get federally reimbursed for the majority of the fund, like the food. That's what we want, because the rest is coming from our tax-paying dollars. And so if there's more students who qualify for free or reduced lunch, which is now going to be higher, hopefully, for those students who are enrolled in Medicaid, that means that that's a higher percentage of meals that can be federally reimbursed. And then that means less meals have to be reimbursed through tax-paying dollars, which is just going to help support Healthy School Meals for longer, making sure that we have better produce and things for students. Another thing that we've kind of discussed that some other states are working on is food is medicine. So there's some other states where the Medicaid in their state basically covers if a doctor can see a patient and says, your diet isn't great for you, you need to be eating healthier foods, whether you're a diabetic, you have heart problems, kidney problems, whatever it might be, a doctor could basically write a prescription for what that patient's food or diet needs to be, and then they are eligible to get reimbursed for their groceries of buying those specific products and meals. And so that's something that we've been talking about, trying to do here is food is medicine, and how do we better support our communities who can't afford healthy produce or organic greens or things like that, by making sure that Medicaid is able to reimburse patients who need to be on specific diets. So that's something really exciting that we'd like to see come into Colorado, and we're working on the back end.
That's great. Yeah, that make the food is medicine initiative also makes me think a lot about people who may be homebound or older adults who rely on like meal delivery services, and how maybe that could be addressed in some way in the program in the future. The transportation needs of people accessing food. So that's really interesting. Thanks, Justice. We have another question from Mac, which is, how do free and reduced lunch applications work? From what I know, they could tend to be very inaccessible. Is there a way to make them more accessible? That's a great question. Yeah, I'd love to hear from Justice and Megan. And Megan, I'm curious if this is something that the community often asks for help with.
So Pueblo has been under the community eligibility provision for about 8 years. So the County of Pueblo, the schools, every single student is eligible for free and reduced lunch, which then becomes free lunch. Because Pueblo has a certain level of citizens and students living under a certain threshold. So in the past, though, people had to, like, families and parents had to put down all of their information to request that they receive free and reduced lunch. So that can be really off-putting and really scary for all kinds of people, because there's a lot of stigma around asking for help just in general. And in our county in particular, and in a lot of places in Pueblo, we have migrant workers and immigrants who may be really nervous to fill out paperwork like that. So there's a lot of barriers, but Pueblo in particular hasn't really had to deal with having to ask for free and reduced lunch at this point, because we've been under CEP for so long.
That's great. I think that's kind of an interesting thing as well, when we think about the Healthy School Meals for All measure that passed. I think some people think that it's kind of gonna like just automatically create like free school meals for all kids, but the reality is that like there has to be certain enrollment in certain existing federal and state programs. So that's definitely kind of an area that's important to keep an eye on as this measure is being rolled out, that like districts are aware of the different requirements for Healthy School Meals for All, and also are able to participate in the reporting necessary to be eligible for these various programs, and then make them eligible for Healthy School Meals for All. Okay, I think we have time for one more quick question. Let's see. So there's a question from Emily, which is, are there any programs or policies that address food insecurity in rural areas within the state? And what do those look like? So Justice or Megan, what do you kind of know about rural programs?
There aren't any specific like policies for rural areas that I'm aware of in any way. Megan might know more than I do on that one. But we have a variety of lists that we just came up with a list recently of all the coalitions across the state, and the work that they're doing locally and on the ground and what that looks like. And the blueprint has also created a social network map. And our aim with that is to better connect our state agencies to our grassroots organizations and our food pantries that are doing the work, and then bringing in community into that. So what does that look like? So a lot of the work that we're actually trying to do is to support rural areas by, whether it's through our advocacy academy, our farm equity coalition, or some of the other coalitions that exist, to try to help them build momentum in those areas through lobbying and policy work, or just volunteering in their local food pantries and increasing the flow of community in that way to make sure people have easier access to food. And we've been trying to connect with more local producers in rural areas and helping them with either transporting food or supporting them with specific resources so they can get their food just out of their local area, but across the state, because a lot of the producers that we've been meeting with have the land, but they don't have the connections to be able to supply, let's say, schools and different things like that. So now that Healthy School Meals for All, a portion of it, there's an allotted 9.8 million that will be starting the 2024-2025 school year to simply support local procurement. And so right now we're trying to create some procurement maps to support the rural schools who don't have those connections to producers and larger farms and things like that, to be able to access local food and then help those producers in rural areas increase their farm and their capacity by getting orders from schools like that and things like that. So I hope that answers your question, Emily. It's kind of loaded.
That's awesome. Thank you so much, Justice. So I think that is all the time we have for questions. I think we're going to go ahead and pull up our closing slide now. We are going to share right now the links to the data dashboard that we reviewed so that you can take this forward and share with your networks. Those links also land on the Blueprint website, so you can go ahead and check out all the good work they're doing there. And also please be sure to check out Pueblo Food Project. I'm really pleased that we were able to have this webinar today and really share the spotlight with the Blueprint and the Pueblo Food Project. This issue of food insecurity is really important to us as a major social factor in health, and we're really excited that we were able to talk with you all today about this really important and pressing issue in our state. So with that, I want to thank everyone so much for joining us. Thank you, Justice and Megan, for our panelists. And with that, we'll let you all go. Everyone have a great Thursday morning and a good rest of your week.